Welcome to the Answers for Elders radio show. Meet the trusted experts who will give you straight answers and will help guide you on the path of later life care. Now, here's your host, founder, caregiver, and CEO, Suzanne Newman.
And welcome everyone to Answers for Elders Radio Network. And we are back with Dr. Shawn Weiss, and we are talking about optimal health, and we talked about oral health. And I think one of the things that we're going to talk about today, we have never had this topic on Answers for Elders. So if you're listening and watching us on YouTube, sit up straight because we're going to talk about posture.
Everybody hears that word, they're like, oh.
And so obviously posture is everything, helps us with our health and our digestive system and all kinds of things. And it also just having that, it lifts us up, right? In emotionally and physically, there's so many things that posture plays into overall health. So I am so glad we're talking about it. And Dr. Weiss, thank you for bringing up this topic.
Oh my gosh, this is going to be hard for me to keep this contained. It's one of my favorite topics to teach on because, being a physical therapist for 26 years, I can honestly say I've never had a patient that I have not incorporated some type of posture exercise for. Mm-hmm. It's that important. And I'm talking, I worked with 95, 100-year-old people on posture, just like Amazing. I work with 15-year-old people on posture.
That's wonderful. That's wonderful. Mm-hmm. So I talked about benefits of good posture, mm-hmm. but I probably haven't even touched the iceberg, right? There's so much more to why good posture is important. Is there not?
Yeah. I mean, if you look at people that maybe are over 70 and you might see the effects, I mean, maybe they're rounded over, they're significantly rounded over. I mean, that takes mm-hmm. years to get that way. So that's why it's so important to start looking at your posture now, right?
Right.
Spinal alignment, when you have good posture, then you're maintaining those natural curves mm-hmm. of the spine versus mm-hmm. if you're, I even used to talk to my kids when you're in class. Oh, I'm in class and I'm like kind of mm-hmm. leaning like this. I'm like, no, like sit up. Mm-hmm. Get your hips square, get your feet on the ground, right?
Yeah.
So maintaining spinal alignment is super, super important. And then along with, if your spine is aligned, then your muscles are balanced, right?
Yes.
It's, an easy way to talk about that is like, if you are somebody that kind of sits on your couch and you kind of, if you're leaning over all the time and you got one leg underneath you and you do that all the time mm-hmm. for years, and it's going to have an effect on your structure, right? So sure. keeping your muscles balanced is super important because that's preventing pain, that's mm-hmm. preventing injury, and we want those muscles to be strong and working for you and keeping you up nice and tall.
Yeah.
Right. So spinal alignment, muscle balance. The other big thing is breathing. So easiest way to explain that is if you are noticing that you kind of are getting a little bit more rounded, or if you find that you're kind of sitting, mm-hmm. Like this all the time, what happens when you start getting more rounded is closing up your chest wall, right? Mm-hmm. All of those muscles are going to get tight.
Yeah.
So what happens is then you're not getting good lung expansion. So when you start to breathe in, you're not able to get full capacity when you breathe in and get good air exchange. So as we get older, as we start slouching more, we start seeing all of these muscles get tight, and then the muscles in the back get overly stretched. So they become weak. So super important from a breathing standpoint that we're able to get good air exchange. That's mm-hmm. that goes along with, I work with people maybe that have COPD, that are on oxygen or have mm-hmm. any other pulmonary issues. One of the first things I'm working on with them, mm-hmm. Maybe they came to me for a shoulder injury. I don't care. Mm-hmm. You have mm-hmm. a history of respiratory issues. We're working on posture to maximize airflow.
Sure. And obviously a lot of seniors, they sit in like recliners, or they sit, they don't necessarily sit in the best type of posturing position. I mean, I'm just thinking, is that a factor as far as is there types of furniture out there that we should think about in that respect? Or is it,
Well,
isn't recliner okay? I guess is my
I
question.
mean, recliners are okay. You just don't want to stay in them for 10 hours a day,
Yeah.
right? I mean, if you're in a recliner, you'll know, especially as you get older, you can only sit in certain positions for certain lengths of time, or you get a little stiff. Like I
Hmm.
have that happen,
Hmm.
right?
Or
And
sleep.
I always,
And
yeah,
yeah.
exactly. So I mean, I recommend having different surfaces. Like if you're like, hey,
Uh-huh.
this is my favorite chair, and you're not going to tell me not to sit in it, and we come across clients like that all the time. This is my chair.
Right.
Then we want to make sure, as a therapist, I'm like, one, is it safe to get in and out of? And you got to get out of it and move every
Hmm.
hour, right?
Yeah.
So,
Yeah.
but from a safety standpoint, from a posture standpoint, we want something that's got a nice supportive back,
Hmm.
um, arms that you can push up from to get out. But you don't want something that's so deep
Hmm.
that it is causing you to not be able
Right.
to sit up straight. And that's something
Yeah.
you can fix by putting pillows or,
Yeah.
or propping things up behind you
Hmm.
that will help you stay in that
Sure.
position.
Sure. And
Yeah.
obviously, and it helps you, I know a lot of people that get headaches or they get stress in their shoulders and they're on maybe on a computer all day. That can affect, obviously, that posture can affect those areas as well. Is that
Yeah.
not?
Yeah. Because from an ergonomic standpoint, that goes back to spinal alignment.
Mm-hmm.
So if you're a senior, and you're still spending a lot of time on the computer, you want that computer to be, you want to be looking eye level at that computer.
Mm-hmm.
You don't want to be looking down. You
Right.
don't want to be looking up. You want your chin to be level. So that means you got to prop up your laptop or prop up something or get a chair higher or
Mhm.
something so that you are looking straight ahead on
Yeah.
your computer
Yeah.
screens.
Yeah.
And, I've had patients where, therapists are known for kind of digging in a little deeper. And
Mm-hmm.
I'll have patients who maybe do office work or still working a lot on the computer, and they have one of the
Mm-hmm.
L-shaped desks, and they're telling me about their neck pain. They're telling me about their back pain. And I'm like, okay,
Oh,
well,
yeah.
tell me about your desk. I said, where's your computer? She's like, well, it's over here. I'm like, what do you mean? She's like, well, my keyboard, my screen's over
Oh,
here,
yeah.
and I'm, where they're turning
Yeah.
all day. Yeah, not good.
No.
So all
Yeah.
kinds of ergonomic things that you can
Yeah.
do for that. Also having the proper alignment, not only with muscle balancing, but it's going to reduce extra stress on your joints,
Mm-hmm.
especially hip joints. Like I
Mm-hmm.
said, the spine, if you are always sitting and or leaning, are you a leaning driver? Or, do you find yourself off onto one side? It's
Sure.
just putting extra stress on your joints.
Mm-hmm.
That's going to increase your risk of pain and
Yeah.
dysfunction with
Yeah.
that. And then the last thing is just having good posture helps digestion. I mean, that's the last one
Sure.
major benefit of good posture. If you are spending your time like this, you really are not allowing proper flow with
Right.
digestion. It's going to slow down motility, possibly of intestinal motility. And so that plays a huge role.
Well, and it probably pays into gastric reflux. It probably and constipation. You
Mm-hmm.
know, and that,
Yep.
all of those things. So one of the things you recommend, obviously, is you said get up once an hour. I think that's huge. How many people
That really is huge.
forever?
Mm-hmm. And as a therapist, I could like start listing a lot of things with that. But one, you got to get up out of that position and stand and move. That's
Hmm.
super important.
Right.
But also things like sitting too much is going to cause a lot of tightness. Like for instance, in your hamstrings, which
Hmm.
are the muscles behind your thigh,
Hmm.
which will prevent you from standing up straight. All of those good things. So definitely
Yeah.
you want to do that.
Right.
But what I see the most in people, I would say over 50, is just starting to see the rounded shoulders and forward head.
Hmm.
And that's something that, if I have a new patient assessment, it's the first thing I'm looking at is alignment, right?
Hmm.
And if they're
Yeah.
starting to hunch over, and sometimes you don't realize it till you look in the mirror and look at how you're carrying
Yeah.
yourself. And
Yeah.
you don't have to like stand like a robot all day, and you
Hmm.
certainly are not going to do that. You want your shoulders
Right.
relaxed.
Yeah.
But when you start seeing the forward head and the rounded shoulders, then we know we're starting to, predispose ourselves to cervical and neck pain issues, headaches, back pain, upper back pain. And
Right.
let me tell you, one of the biggest things, and it's not just affecting the kids, the kids, the teenagers, the college kids, we are seeing it with even people our age, Suzanne, is just right here. I mean, there's such a thing as, it's called tech neck. It's a real diagnosis. It has a code, a medical
Absolutely.
code, because it is so prevalent of being down on your phone.
Mhm.
So that's one of the biggest changes I've seen in the last decade or
Mhm.
so, is just
Mhm.
the incidences of younger people having these postural problems
Absolutely.
from being on the devices. It's just terrible. It really
Mhm.
is. But
Mhm.
like I said, more importantly, when we're looking at, no matter what age you are, if you're starting to round and
Mhm.
you're starting to get a forward head position,
Right.
right? What happens? Let's say you're standing and you're in that position.
Absolutely.
If your center of gravity is now more forward,
Forward. Mhm.
forward. And you will, if you are, the more significant that is, the more you'll feel weight through the front of your feet, like the balls of your feet. So you know that your center of gravity is not where it should be. That really increases your risk for
Mhm.
falls.
Yeah.
It affects your gait pattern. So we do a lot of things with that. If somebody is showing that they are at a risk for falls based just solely on their posture, or have that, thoracic kyphosis, that
Yeah.
kyphotic posture, you're not
Mhm.
going to get rid of that like
No.
completely, but there's certainly things you can do to
Yeah.
start strengthening the muscles in your upper back to
Right.
allow you to hold yourself up for longer
Mhm.
periods of time. I know, so
Right.
just makes you want to stretch, doesn't it? Like, you're just like, oh,
Yeah, when I do this,
feels
I
so
can feel
good.
those muscles.
So good. I know.
Yeah.
It's so
And
good.
and that's interesting too, because a lot of us, it's the world of binge watching. It's the world of, all the things that we do that are so convenient, that we're not getting up and we're not doing things. So finding things, especially in the summertime, there's a million things that we can do to get out and be active. And, certainly I was lucky because my mom was very adamant that you sit up straight and you stand straight, but
Or
not
poke
every.
you in the back.
Oh yeah,
Poke you.
constant. But I see people around me that are in their 60s that are kind of hunch over. And that's something that is concerning. So obviously at this age, when they're this old, you can't completely correct it. But what are some things that people, if they have a little
Yeah.
bit of hunch, is there much they can do?
My very favorite exercise, which I can say I probably have given to absolutely everybody, even
Mhm.
if they're on the street or my family has, I'm like, oh,
Mhm.
try this, do this. One, when you wake up in the morning and you sit on the side of the bed, because think about, we usually sleep kind of curled a little bit,
Mhm.
at
Mhm.
some point in the night. So everything's tight. One of the best exercises you can do is a simple row.
Mhm. Like this.
It's like rowing a boat. So if you
Mhm.
put your
Yep.
arms to your side, pull
Yeah.
back like you're rowing a boat, you
Yep.
squeeze your shoulder blades together, and then come forward.
Yes. That's
Squeeze your
awesome.
shoulder blades
Boy,
together
do
and
you
come
ever
forward.
feel that?
Do
That's
that.
really.
Yeah, and you will feel that stretch. But when
Uh-huh.
you're squeezing your shoulder blades, you're strengthening your rhomboids, which are the muscles between
Yeah.
your shoulder blades. So you're stretching in the morning, and you're going
Well,
to
and
get
it's
that, be able to
also
get
opening
good
up,
breath,
yeah, the
your chest
breath.
wall. Yeah.
Yeah, that's
So that
amazing.
row, and then I'll have people, you can get the exercise bands
Mhm.
and you can tie them to the doorknob and you can
Yeah.
pull and do that
Yeah.
same exercise with resistance. It's literally one of the best exercises
Mhm.
I recommend for posture. I've seen people
Wow.
make significant changes just by doing that exercise.
Well,
Other ones are like wall slide,
yeah.
standing in the walls. Um, Again, the whole point is stretching those pectoral muscles, getting the
Mhm.
shoulders back and down. And
Yeah.
then, okay, well, how are you going to hold it there? So now you got to strengthen the muscles in the back
Ah,
to be able to hold yourself up into that
yeah.
position.
This is really, really important information. Thank you so much. And for those of you that are interested, you can go to Dr. Shawn's website. Which website do you use for your posture type? Is it on your Senior Health and Wellness or your Shawn Michelle? I
Both,
guess both.
both.
Okay.
Seniorhealthandwellness.org.
Mm-hmm.
Seniorhealthandwellness.org is where I have everything
Mm-hmm.
really geared for 50 and over,
That's
prevention and
awesome.
wellness, or the Shawn-Michelle. I know that that's really hard.
Uh-huh.
MICHELE.com has some free posture guides on there as well, but I can certainly link that.
Fabulous.
for you guys
Yeah.
too.
Yeah, well, we have it on Answers for Elders, but just go to her expert specialist page. There's all kinds of information. And guess what, everyone? Dr. Shawn is our specialist for 2024 in terms of the Vitality Revolution that we do every year this summer. So we're looking forward to having a lot more content like this. So thank you so much, Dr. Shawn Michelle Weiss.
Thank you.
We at Answers for Elders thank you for listening. Did you know that you can discover hundreds of podcasts in our library on senior care? So visit our website and discover our decision guides that will help you also navigate decision making. Find us at answersforelders.com.